The national healthcare crisis touches every neighborhood in our community. Families in almost every zip code of Hamilton County do not have access to the most basic care. In our community alone, that means more than 43,000 people do not qualify for a government health care program, do not have an employer program, or cannot afford private health insurance.
I noticed a change in my swallowing, and I checked my throat, and I discovered a place that looked, suspicious, and it turned out that it was cancer. I basically was, just going without medical care until a medical issue came up.
I have had insurance almost all of my life, and then job changes and things that affect your insurance affected me. I mean, I was very devastated to think, what will I do? You're 50 plus age and wondering, what do you do?
Because you're hoping that you don't do something that's going to cause a problem, and therefore you're constantly trying to watch yourself.
We have not been able to get insurance, and if it hadn't been for volunteers in medicine, there'd have been a lot of things that we'd have had to done without.
Volunteers in Medicine steps in when other healthcare options end. The Volunteers in Medicine clinic fills in the gap for thousands in our community. Who can use this clinic? Volunteers in Medicine sees anyone who is a 90-day resident of Hamilton County who does not have health insurance and whose family income is below 200% of the federal poverty level. Some of our patients are between jobs. Some hold jobs where their employers don't offer insurance. With more than 43,000 in our community, we all know someone who qualifies for service in the clinic. Volunteers in Medicine President Nancy Franks explains the patient population at the clinic.
They are members of our family or our churches, or they live in our neighborhood. It is the person that serves us at a restaurant, fixes our plumbing, or helps us with a retail sale. It is sad when these people are ill. They can't get help because they don't have health insurance and cannot afford medical care on their own. We are here to help these folks.
In the first 4 years of operation, the Volunteers in Medicine clinic treated 18,000 patient visits. And in that short amount of time, the clinic provided health care valued at over $5 million at clinic rates, or valued at an astounding $20 million at emergency room rates. And no patient was charged for the services rendered. All this is done with 4 paid employees. That's right, 4. How are millions of dollars of medical care provided with such a small staff? The power of volunteers. In a typical month, more than 80 volunteers serve in the clinic. Many are healthcare providers like doctors, nurses, pharmacists, and medical technicians. Others greet patients, answer the phone, pay bills, work on our computers, or prepare our mailings. Because of the outpouring of help, the clinic can provide excellent care at no charge while operating at a minimum cost. Pastor Mark Flynn sees the impact the clinic makes on members of his congregation serving at the clinic.
I think the Volunteers in Medicine clinic is exactly what the church needs to be, an extension or reaching out into the community. I mean, we're taught to be like Jesus and to continue the ministry that Jesus began. And we all struggle with how do you make that happen when it comes to health care, caring for people. And that clinic makes it happen.
The patients are so appreciative. They just really can't say enough good things about the clinic. It's just so satisfying. It's so great to be able to help, and it's such a necessary service.
I've really enjoyed working here, and everybody is here because they want to be here.
A local pastor or volunteer begins every clinic session with a devotion. This reflective time reminds each team member of the culture of care that begins when a patient walks through the doors of the Volunteers in Medicine clinic. And that mission drives decision makers within the clinic. Dr. Robert Bowers is well known in the medical community and across the state of Tennessee. Recognized as Tennessee Physician of the Year by the Tennessee Medical Association, Dr. Bauer serves as the medical director, serving as a volunteer.
Our main goal is to be the primary care medical home for our patients. The real purpose is the joy of serving others. We have a sense of accomplishment when we can take an ill friend or a neighbor and diagnose his condition and see him through to his recovery, or at least manage his illness.
And because of the medical volunteers, the list of services has expanded to include podiatry, physical therapy, gastroenterology, gynecology, neurology, optometry, orthopedic assessment and cooperation with Project Access, dietary counseling, and life issues counseling. X-rays are done on site, and partners in the community help with diagnostic and lab work.
The need is real. There are people who simply don't have access to genuine medical help, whose lives are cut short because disease was not detected early enough. Volunteers in Medicine saves lives in our community.
The Volunteers in Medicine Clinic takes its inspiration from Dr. Jack McConnell, whose father served as a minister in the Tennessee Valley. Dr. McConnell started a volunteer medical clinic in Hilton Head, South Carolina, and the Chattanooga faith community used his work as both a model and motivation to begin a similar ministry here.
I'd ask them, for the lack of anything, just something better to say, where do you get your health care? And they all told me the same thing. We don't get access to health care. And I said to myself, you can't stand by and watch the poor be abused. No civil person would do that.
But we do that.
I know we
as
do
a
that.
society, we do that every day. Why did you not just ignore it?
I couldn't.
It's a privilege to see the healing power of God's people and to work with such dedicated volunteers. This project must continue in order to make an impact for those families in medical crisis. But we can only do that if our support grows. We invite you, the people watching this video, to join us in taking part in this volunteer course serving this clinic. Believe me when I say we need the talents and gifts of everyone. We just need you to get involved.
We invite you to become a part of the continuing success of the Volunteers in Medicine Clinic as either a contributor or a volunteer. The life you change may be your own.
Get in touch with this organization, see if you can qualify for it. Come here and be helped.
I just appreciate the personal touch. I'm thankful that there are institutions like Volunteers in Medicine to help folks who wouldn't otherwise be able to have any medical care.
And I had never been in a situation where I couldn't do it myself. And it was amazing that there were the resources here through Project Access and Volunteers in Medicine to fill in that tremendous gap. Because without it, I mean, there would have been no place to turn. I don't really know what I would have done.
Hello, my name is Jeff Olinge, and I've had the honor of being on the board of directors of the Volunteers in Medicine Clinic here in Chattanooga. It's unfortunate when our friends and neighbors, who often are also our employees, are sick and can't work. As business people, we think about lost productivity, but it's more than just that. It's a moral issue. How can we stand by and not take care of those friends and neighbors? Volunteers in Medicine is exactly what we need to take care of our own. By working together, we can make a difference in our community. We need you to get involved. You can help spread the word. You may have skills and resources helpful to the clinic, and we need ongoing funding to keep this valuable work going. I trust we can count on you. Thank you.
Please contact the clinic at 855-8220 or P.O. Box 81057, Chattanooga, Tennessee 37414. Volunteers in Medicine is a 501c3 corporation. Therefore, gifts qualify as charitable contributions. Thank you for listening to this incredible story.